This is a demonstration of removal of a nasogastric tube, and once again our standard steps would have been accomplished. I would like to say to you that when you enter the room to remove a nasogastric tube, it may seem like a positive thing to you, but it's not necessarily a positive thing for the client or for Ms. Nightingale. So we're not going to go into the room and say, oh my gosh, Ms. Nightingale, I can take your tube out today, I'm so happy for you. No, you're going to be professional about it and say, Ms. Nightingale, I am here to remove your nasogastric tube. Your physician has had that ordered, and do you want to talk about that at all, or give her an opportunity to say. Some people are afraid when these are coming out. They've been being fed. Food is love and food is life, so be just careful about your approach there. So I am going to have on my clean gloves, and I will loosen the tape around the nose. Do I have to check for tube placement with this procedure? No, I don't. I'm taking the tube out. So I'm going to loosen that. I have an emesis basin ready because there may be a little bit of reverse peristalsis. I am going to insert an amount of air into the tube, and I'm doing that in order to clear the tube of any secretions. That's my first step in being sure that I don't have aspiration as I pull this tube out. So I'm going to insert air, and then I'm going to have Ms. Nightingale take a deep breath, and I'm having her do that also for purposes of inhibiting aspiration, because when we take a deep breath, that epiglottis closes over the trachea. So take a deep breath, and then I'm just going to pinch the tube and pull it out, and I'm just going to examine it to be sure that there's been no damage done and that everything came out. This then goes in, I can curl it up in my glove, but it's going to go into a biohazard bag. And my next concern is oral and nasal care for Miss Nightingale. So I am going to check her nares. I might use a warm washcloth since I've had that tube down there. It just might be comforting. If I have any kind of excoriation, hopefully I've seen that before this point, but if I do, that will need to be addressed with the treatment. And then I think your CBE says offer mouth care, but you're going to do mouth care. This will be necessary at this time. So toothbrush and toothpaste is the very best. If you don't have a toothbrush and toothpaste, or that's not working with your client, then the little pink tooth aids are probably the best because they have some abrasive action to get the tartar off the teeth. Now, she's been in an upright position, this 30-degree angle, for quite a while, a number of days probably, because she has had this tube feeding. So we want a position of comfort right now, so you could lower it just a little bit down, kind of get her acclimated to not having her head up all the time. But at this point, she could lay flat. Then I'm going to document, and my documentation will include her affect or mentally how she handled this. But I also want to, my action would be that I remove the nasogastric tube per the physician's order. And then what is her response? The nasogastric tube came out without difficulty. I could document her mouth and how her mouth looked. Her nares were clear. And I think that's it. There's one more thing I wanted to say to you about setting up, though. On the previous demos, I had set up here. There's no reason why you can't set up here. For this one, I set up here for no particular reason except to remind me to tell you that get it set up how you're comfortable so you're not turning the back on the field, and get it close to where you're working. So don't be working from here to here. So you want this close. And then while I have the chance here, I'd also like to say I'm a big proponent of always having a field down. And when you have a field down, keep everything on that field. So you can use a Chuck's pad, you can use a towel, clean, you know how these bedside stands get, clean the bedside stand off and then get a field down. for you to work from, so then you know you have a clean view. I think that's it. Does anybody else have anything to add? Okay. Withdrawing the nasogastric tube, 2 things to prevent aspiration are putting the air down and having the patient take a deep breath as you pull it out in order to close the epiglottis.